is to ensure that everyone is vaccinated, but particularly individuals who are taking care of the people who are sick. And I'm talking about the confidence that people need to have. Whether you're an expectant mom heading into the hospital, checking in, an anxious time in your life, you need to be assured that the person taking care of you is not going to give COVID to you or your newborn. Can't we just say that that is a basic right that everyone has, to know that they'll be safe when they enter a healthcare facility, or you have your elderly parents or grandparents in a nursing home, that they will not get sick because of someone who's charged with their care? We're talking about just common sense here, my friends. And think about another person who's in a car accident, and maybe they're getting chemo treatments on the side, and they're just immunocompromised. They have a right to be treated by someone who will not make them get sicker. So please help us get the message. My job number one in this state is to keep people safe. Clear, simple. There's no way to cloud that. There's no gray area. I need to keep people in this state safe. And we'll be nation leading with our mandate, which strikes at midnight tonight, when everyone is expected in a hospital in the state of New York or a healthcare facility to have been vaccinated. I believe that California is going to follow suit in a couple of weeks, and the President's guidance goes into effect in late October. But we are hit the first, we are hit the hardest, and I want to be the first to say we're over this. And so I'm calling on all the healthcare workers. First of all, those of you who've been vaccinated, I thank you from the bottom of my heart for doing what was right and helping lead the way so we do have the confidence we need. And to those who've not yet made that decision, please do the right thing. We have a lot of facilities, a lot of your employers are anxious to just give you the jab in the arm and say, you're part of the family, we need your help, continue on. And many of you have spent your lives dedicated to learning about science and medicine and how we can save people's lives no matter what the illness is. We know this has been tough, we know this has been a hard decision, but we really do hope that you'll come around to that decision to help us make sure that we can do everything we can in our power. And that's what I'm using as the full power of the state of New York to ensure that we do everything to protect people. And again, this is simple common sense. We all know what common sense means. It's just doing the right thing because it's so obvious. And that's what I want people to conclude. Right now, our numbers, I will give a report as soon as we get more numbers on where we're at in terms of vaccinating our nursing home workers and our healthcare workers. I was on the phone as I was walking in here with the leaders of our downstate healthcare organizations. I told them how proud I am that many of them have achieved 98%, 99%, which is extraordinary. And I wanted them to convey on my behalf and the people of New York, thank them for their leadership in having this occur, but also to the people who listen to them. But we'll be convening what I'm going to call an operations center, where we're going to find out the resources we have at hand. I've asked some of the hospitals who have those high numbers to give us the names of individuals who are willing to go elsewhere. We're going to have to build a team and be able to respond to areas where they've not been so responsive in terms of making sure their employees have not answered our call, our requirement that they be vaccinated. So we're going to work it out. You saw the release I put out over the weekend, which was to identify all the tools that we have at our disposal. I will be signing an executive order to give me the emergency powers necessary to address these shortages where they occur. That's going to allow me to deploy the National Guard, who are medically trained, deploy people who've been retired, who may have had a license lapse, bring in people from elsewhere. That is not my first position, though, my friends. My desire is to have the people who've been out there continue to work in their jobs, work in them safely, and to all the other healthcare workers who are vaccinated, they also deserve to know that the people they're working with will not get them sick. We now know that there are cases where people are reinfected, that there are cases of breakthroughs. If that wasn't the reality, this could be a different conversation, but even people who've been vaccinated, it's a low percentage, but who wants to take that risk? Nobody. We've been through too much together. We don't want to take risks. We just want to do what's right. So with that, I want to introduce Henry Munoz and thank him and as a leader, and Dr. Chin for what they've done, bringing the services here and all across the state. I've been in more of your facilities